Do you need your neck pain knocked out? Hey, I'm Dr. Aaron Wall with Gateway Chiropractic in Fort Worth, Texas. This is how our office knocks out neck pain. Maybe you're watching this because you've been dealing with chronic neck pain for a while now and it's just not getting better, no matter how many meds or pain meds you take or how many massages you get or how many injections you get. There's a lot of things that people do when their neck pain gets really bad, but at the same time, what we find is that a lot of that really isn't going after the root cause. It's very symptom-based. So if you're really wanting something different, non-drug, non-surgical, non-steroid injection for your neck pain, and you haven't figured out what to do yet, I'm really glad you're watching this because I want to show you how we can get after the root cause and in most cases really change your life for the better. So I want to kind of take you through how that works in our office. Obviously, we're a doctor's office first and foremost, so there's things that you'll have to do when you come in, when you set an appointment with us. We're going to do a detailed examination with you, but first we need to get a really good history of what's going on with you. What led up to the chronic pain that you're dealing with in your neck now? A lot of things can contribute due to injuries or auto accidents. Also lifestyle, the way you sleep, the way you sit, maybe it's the way you work, maybe you have a desk job in front of a computer all day. All these things, a lot of times over time, can really lead to where you're in really bad shape with your neck. So we want to find that out. That helps us be better with getting to the root cause and figuring out how to get you healthy and just get that to where you're not dealing with the neck pain anymore. So let me kind of take you through. Once you fill out paperwork with our front desk, we're going to take you back to a very important room. That's our exam room. So as we're walking back in our office to the exam room, something really important about why we come here first. There's a series of tests that we're going to do with you if you have neck pain. You're going to meet with either myself or Dr. Carter. And when you're in this room, we're going to be doing detailed analysis of your neck. So we check usually the entire spine as well, not just the neck, but in this instance, obviously we're going to pay a lot of attention to the neck if you have neck pain. We're going to be doing thermography. When nerves are damaged, they get very hot. Let us know areas that we need to do x-rays. That's where this comes in. This is our digital x-ray unit, very specific x-rays. We can get after and visually see what is causing your neck pain to happen and how we can go about adjusting and to correct. Because again, we don't guess when we help patients. All of our adult patients have had x-rays prior to being adjusted. It's just the very smart way and smart approach. That way it's specific to what your neck needs to get you better. Plus, if you're not taking x-rays, you're not seeing it truly. You're just doing an educated guess. We don't want to do that. We do x-rays. That's just kind of what we do. After we take x-rays and figure out the root cause, I'm going to show you. Come up here with me. We're going to do an adjustment with you. That's also important too. Everybody heals a little bit differently when they get an adjustment. We want to see how you do when you get adjusted because based on how you respond, that also dictates as far as treatment, frequency, duration, things that, again, everybody has those questions. We can get very accurate on our diagnosis with you and our outcomes, what we expect, all the good stuff that you want to hear on how you're going to get better. But I want to show you something first before I show you the adjustment bay. This is our rehab room. If you have chronic neck pain, you will be familiar with this room before too long. But something I wanted to point out first, we have another video in our neck pain series I want you to check out. It's stretching and some rehab that we do in the office and some ideas for you to help you at your house. But one thing we do, it's called cervical traction. This is what we would do if you have neck pain and it's chronic before we adjust. What this does is kind of like decompression, but it's you doing it, not a machine. And what you do is it loads all the disc space. It helps hydrate those discs. It warms up your muscles and ligaments. So your neck adjustment is a lot easier on you. Because some people are so tight, with their neck issues, they got so much inflammation. This is a great way to loosen that up. And it makes this next area even easier on you. So this is really the most important area in our whole office. It's our adjusting bays. And we have two bays, they're identical, both sides. But when we're in here, this is after we've studied your spine, done all the testing, done all the x-rays, know exactly where to adjust you. All your notes will be popped up on this, on our digital software computer here. And we do a series of adjustments. We do manual adjusting, we do table assisted adjusting, and we do instrument-based adjusting for all types of people. Some people are excited to get adjusted, some people a little bit reserved, a little bit nervous. So we have different ways to help. And what's great about the way that we approach this, we have so many people that have had neck surgeries. There's literally hardware in their neck and they're not better. And they've been told by so many people they can't get adjusted, they can't have their neck adjusted. but they come in here, the way our system works, we can work around those surgeries and still adjust them. Different ways we can do that, and they can still get really good change. That's something that we see quite a bit, and it blows people away that they can still get adjusted even after having a surgery that hasn't helped them. So this is a big area that we will obviously go over with you when you do come in. But if what I'm saying makes sense and you're going, I've never had that extent of chiropractic done to me, or you've never had chiropractic done in general, and you want to get to the root cause of your neck pain, give us a chance to help you really change your life. There's a schedule my appointment link next to this video. You need to click on that. You can find a day and time that works for you to come into our office. And again, allow us to take you through our process. I promise you, we can really change your life, get you healing like you haven't been in a long time. So I'm Dr. Aaron Wall, and check out our other neck pain videos.